April is Donate Life Month, where you can choose to give the gift of life by donating organs, eyes, or tissue. Presbyterian St. Luke's Medical Center has a transplant program and provides both liver and kidney donations. And joining me now is Dr. Clark Kulig. He is a transplant hepatologist at Presbyterian St. Luke's. Thank you so much for joining us today.
Thanks, Michelle. Pleasure to be here.
All right, so a person is added to the wait list for an organ every 9 minutes in our country. How does the wait list work?
Well, it is a big list, Michelle. It's 100,000 people across the U.S., over 100,000 people. And at least for liver disease, people are prioritized by how sick they are. We've got a prioritization equation from their blood test to understand who's the sickest on the list within our area. And then over the last several years, nationwide for liver transplant, at least we've worked, the nationwide system has worked to provide organs at a farther distance, to make matches over a longer period or distance to help make the system more equitable for people. There are disparities across the U.S. in terms of how organs are given out, and there's been a move 3 years ago to spread that out a bit more. And there's other things we're working on currently within organ transplant to further those goals.
Yeah, that is good to hear. Why should someone consider being a donor, and how do you become one?
Well, it's really amazing. It's such a logistical miracle, frankly, to have a donor, someone who's died, they're brain dead. And it's very sad. And, actually spring is it's a bittersweet situation where you have that loss, but you also have new life. You have new life. The winter's going and you've got new life coming. So spring is why we have Donate Life Month in April. But so much good can come of this. When a tragedy has happened, somebody's lost their loved one, but over 10 people can benefit from organ, eye, and tissue donation from a donor, which is really incredible. You think of all the priceless smiles and extra time with families for more than 10 people from one donor. It's really incredible. And we should be proud in Colorado, we have the most people registered in the U.S. for organ donation via the driver's license system. It's really incredible.
You talked about tragedy, but there are also living donors. They're becoming more popular. What should potential donors know about this service?
Live donation is really interesting, and for the right kind of size of people, you need healthy donors. But it's another way, with a nationwide organ shortage for transplant teams to have organs for transplant for patients. It's another way of trying to stretch out a limited resource by adding another mechanism for donation, which is really fantastic for kidney donation, even liver donation, and other organs as well. So it's really a fascinating way to help. Where we're really the bottom line is we're just short of organs for people. 100,000 people in the U.S. waiting for organs who need them, and over 20 people dying on the list. There's different lists for different organs. Over 20 people dying per day across the U.S. So it's an unmet need. Live donors another way for that to be stretched out for a limited resource.
Well, Dr. Kulig, thank you so much for taking the time out and joining us today.
Pleasure. Thanks for having me, Michelle.
Yes, very important information there. And remember, you can watch all of our health interviews right now on CBSColorado.com.
This is a First Alert weather.